Okay, so what did you say we were doing today?
Hello, my name is Harley Richards.
My name is Kate Vorwald.
Dr. David Kirkpatrick.
Dr. Natalia Nunez.
And I'm an oral surgeon.
I am a board-certified oral and maxillofacial surgeon.
I'm an oral surgeon at New Teeth Now.
Today, we are answering all of your questions about anesthesia.
And I want to tell you that there are no bad questions. Anesthesia is a state of unconsciousness that is controlled by various medications that are given to you, and they work on your central nervous system.
Whether it's given through the IV or gases that are given through an endotracheal tube, those medications will sedate you and allow you to fall asleep.
In our services, we provide complete general anesthesia, in which during the New Teeth Now procedure, you're going to be asleep, and when you wake up, the work is done.
When we're doing these large cases where we're doing the implants for a full jaw, whether it's the lower jaw, top jaw, or both jaws, we recommend general anesthesia.
If you did not have the anesthesia, then you would actually feel and know everything we're doing, which would probably not be a very pleasant experience.
One of the things that makes us different is that we secure your airway with a tube so that you can enjoy first the benefits of the general anesthesia, but also we are very proactive into keeping your airway safe.
You don't want to be under a light sedation where you're semi-asleep, semi-awake, hearing the different noises, having to, get suctioned all the time from all the water that's running down your throat. So it's definitely something that you want to be completely out and asleep for. And we do it under a general anesthetic, so you are completely asleep. We have your airway protected, and we can suction all that fluid out for you without you even knowing.
No, it would actually cost you thousands more for me to even walk in the room to think about doing this procedure to you without anesthesia. No, you will not tell any secrets about any part of your life that you want us to know or do not want us to know.
So it's very unusual that you would tell any secrets that you would not ordinarily tell if you were to, say, maybe be drunk.
Sometimes you can tell a little bit of secrets when you wake up. That's a fact.
What are the best secrets you heard?
Those are for me to keep.
An anesthetic alone will not necessarily paralyze you. However, we can give additional medications that are considered along the lines of a paralytic. However, paralytics alone are not given during a general anesthetic. You are still maintained in a sedative state so that you're not conscious while you are given a paralytic.
No, you will not be feeling any pain during surgery.
You're completely asleep under general anesthesia, and that's one of the reasons that we have our own anesthesia team to come in to put you under general anesthesia where there's zero pain.
You will also receive some numbing medication in the mouth so that when you wake up, you are still very comfortable.
You do not wake up under general anesthesia during our procedures. That just doesn't happen.
Because you're under general anesthesia, which is one of the reasons that we at New Teeth Now choose to place patients under general anesthesia.
Because we have a dedicated CRNA that it's making sure that all your vitals are stable.
There are signs on our monitors that we are using throughout the surgery that would allow us to know whether you're starting to become more awake, but still not to the level of consciousness that you would realize.
No one's going to become addicted to general anesthesia. It's one of those things that hits you fast and it goes away fast, and you will not be addicted to general anesthesia. You may want us to come to your house like Michael Jackson and have general anesthesia to get sleep every night, but you will not become addicted to it.
The major agent that is used to keep you asleep during anesthesia is an inhaled, it's a liquid that's volatile, so it vaporizes, and you breathe the vapors of this liquid, sevoflurane, and that's just not something that you would become addicted to, no.
Sometimes it hasn't happened. Luckily, I do have a couple of surgical assistants that can help to keep you calm and bake you and basically nurse you back into being a sweet patient as you came in.
But it's very uncommon, particularly, you know, if they start swinging, we just swing back at them. Give them the old 1-2. No, that's extremely unusual.
Sometimes people wake up and they really are unaware because they've been totally asleep under the general anesthesia, and they wake up and they may forget or not remember where they're at for just a few seconds, and they are kind of a little scared about waking up, and then they realize where they're at and they calm down.
I would say generally patients wake up very calm and don't hit us.
Well, anesthesia is a continuum where you have IV sedation on this end and general anesthesia on this end. The IV sedation is not a deep level of anesthesia. You would still feel the procedure unless the area is numb. Deep IV sedation is a state of unconsciousness where the doctor needs to be more trained, whereas light IV sedation is typically what you would see in a general dentist situation where they're, you know, wanting to give you a little something, but they can't give too much.
Not every center is going to have the capabilities of administering general anesthesia. There is rigorous implementation of security as well as safety assets that you need to have in check. Also, you do require specified personnel and machinery that not every center is qualified to give.
And so oral and maxillofacial surgeons within their after dental school residency training programs, which are from 4 to 6 years, get significant anesthesia training, whereas general dentists get 0 anesthesia training in dental school, and they maybe go take weekend courses so that they can administer IV sedation. And so from a surgeon's perspective, general anesthesia is the safest way to do this.
Well, we all make choices, and sometimes those choices are good ones and sometimes they're not. We recommend, per the anesthesia guidelines, that patients do not eat or drink anything for a few hours before general anesthesia, and there's some really good reasons for that. A, we want you to make it through the case and not have a complication that would send you to the hospital and possibly lead to you never leaving the hospital. But yes, we do tell patients to not eat or drink anything for your safety because we don't want you throwing up and getting really sick from the general anesthesia.
No. I don't remember a time when a patient under our procedure has lost their bowels.
But it is possible to have an accident. That's one of the reasons that we ask patients to not have anything to eat or drink, you know, for a certain amount of hours before the anesthesia. I'm not really sure. Some people do a lot of things that I'm not sure about. At some of the other clinics that try to do, you know, the full arch reconstructions.
I feel that not including an anesthesia fee within your pricing means that you're willing to do the procedure without anesthesia. And that is not something that I'm willing to do for both my patients and myself. Again, I feel that it's unsafe to do the procedure under a local anesthetic only, specifically for patients that require zygomatic implants.
Everything that you're gonna get in our initial appointment in terms of the cost from beginning to end, that's what it's going to be. We're very, very clear in regards to our fees with you.
These are all great questions. There's no such thing as a bad or dumb question. Please keep those questions coming.
And we here at New Teeth Now, our primary goal is to educate you about all this stuff so that you can make an informed decision about what you're getting ready to do.
So any questions that you can think of, please send them in. We'd love to answer those online.